Hi, I'm Letitia Swanson, and I'm a nurse at OSF Saint Anthony Medical Center. On a typical COVID day, I will have already showered the night before and started to get ready for work before I even go to bed. Once I get here, then I just see my assignment. We gather with our group of nurses and get a basic report as a team and just go over kind of a brief summary of each patient. We come in, we review the labs, notify doctors if there's any blood work that needs to be redrawn, or let them know if there's any blood work that needs notification for the doctor. And then we give the appropriate treatment. As we're going into each room, we have to carefully gown up. We put on our gown, we put on our N95, our face shield, and our gloves. We try to make sure that we have everything that we need as we go into the room. So it's pretty tedious to make sure that we have everything. Once we take our PPE off, we take off our gown first, and we take off our N95 mask. We put it in a paper bag, and we save it for the day. Unless we notice any change in the seal around our face, then we keep that mask through the day. And then of course we have to wash our hands, and we're sanitizing after we take off each item that we're gowned up with. Once we head home, we have the option of taking a shower here if we want to. And then of course we'd have to supply our own clothes. I think when we first started out, it was very nerve-wracking. There were a lot of unknowns, and there still are, but we're discovering things little by little. There were some days where it was very discouraging to have to see some of the things that patients had to go through and be by themselves. I'm sorry, I'm trying not to cry. And having to, hold somebody's hand when they're on death's door, that's very distressing. I would want people to know that we appreciate your patience when we're not able to get back to you right away. I know that can be really frustrating, having to wait, and I definitely appreciate it when people are able to hold off for a little bit so that I can take care of so-and-so patient and make sure that they're okay before I try to call anybody and get back to them on updates.